listening to Living with ADHD and CPTSD, available on Apple and wherever you get your podcasts. Hello everybody and welcome to another episode of Living with ADHD and CPTSD. Today's CPTSD episode is going to be slightly different. I'm going to try to do some motivating and approach this in a different manner than what I have typically done in the past. The reason that I'm going to discuss being motivated to get out to my audience and to reach them is because I have really begun to understand, and I'm really for people who aren't sure about CPTSD to truly get out there and get the help that they deserve and that they need, and that is out there for them. Because a lot of people out there today are just learning. A lot of adults are just starting to understand and are starting to realize that they too, in some form in their past, in their childhood, in their teenage years, have dealt with and suffered from childhood trauma. Whether it's from a narcissistic family, a relative who you were babysat with, or they babysat you when you were a child, whether it was growing up with a covert narcissist, someone who emotionally abused you on a regular basis, someone who physically abused you, and that could even just be. And that could be like physical assault, that could be sexual assault, that could be emotionally assaulting you. So if they're always gaslighting you and making you feel like you don't know what to believe, or you find yourself going crazy and not believing your memories or your thoughts or what's going on in your mind, or you have no idea what reality is, then you need to think about looking and really taking charge of why and what's happening and get you the help that you deserve. Most people out there today who grew up in a family that, whether it was their mother or their father, that suppressed them, didn't allow them to really have any kind of freedom and discipline them unnecessarily, and was taking advantage of them for their own personal gain, physically abusing them to get satisfaction and to get to feel better about themselves. They always wanted attention. They were trying to train you and turn you into someone that was just perfect for their, as their toy or as their protege. And it was a daily thing. They would always, they would never give you any gratification. They would never applaud you, or they would never, say good job when you did something that was amazing or fun, or that you yourself were proud of, and they would shut you down and make you feel rotten about it, or make you think that you were undeserving of this amazing accomplishment that you've managed to do. You need to, you may not even realize it. You may have been so oblivious to what was going on in your past that all these things that you're scared of that are happening, even if you're let's say you got an addiction It could be alcohol, it could be smoking, it could be drugs, it could be sex, it could be video gaming, it could be traveling, like getting away from where you are born and always leaving and or never finding a job that was good and always leaving the job whenever it got tough. Like there's like thousands upon thousands of different little examples and things that would occur in everyday life as an adult that you didn't realize in that moment, and you wouldn't realize for a very long time unless someone brought it up to you, or one day it just got to the point where it was just so much that you just couldn't handle it anymore. Then you would start to think, and you would start to examine your past, and then you would get out there and you'd look for a therapist, and you would tell them, it would be very terrifying, and you'd be scared to tell them and to talk to them because you don't trust anybody. It's very hard. If you can't trust your parents, then how are you going to trust a stranger who you don't know? You're putting your life and your past in their hands, and you're trying to believe in this person that they're going to do what's best for you, and that they're going to protect you and keep you safe, and that no harm is going to come to you when you talk to them about these things. And the fact that you're going to learn that as you go through these steps and you go to start the healing process from your complex trauma and that child abuse that you went through on a regular basis, that you're going to have moments where you're going to have terrible flashbacks, and you're going to start to think that you're back in your childhood again. You're going to all of a sudden go, what the heck's going on here? And you're going to run, or you're going to hide, or you're going to start believing that you're 6 years old again, and your dad is being violent towards you and hitting you and abusing you, or he's emotionally putting you down all the time and thinks that you're worthless and you're not a good person. Like he's always putting you down, and he's always taking advantage of you, and it's occurring on a regular basis, and he always hits you, and he abuses you so much that you're terrified and you fear for your life. And so you start to develop these parts that step in to protect you. So the child who's being abused and has no way of getting away, because he relies on those parents to protect him and feed him and clothe him and give him shelter. And if they don't provide that for you, and they are physically and mentally abusing you, you don't have that ability as a child, as a 6-year-old, to move and go away, like move halfway across the country and start over. You don't have that option. So you end up having to struggle in life, and those child parts are born, and they come into your life to take care of you and to make sure that when this stuff is happening, when this abuse is occurring, that you can hide. And you may not physically be able to hide in the closet or under the bed or in a treehouse or somewhere that is safe, but they give you that ability to mentally hide from the pain and the fear that is there, and that's what they're doing. And so, as the adult, when you start having these flashbacks to childhood trauma, and you're freaking out because you don't know what's going on, you can't understand it, and weird things are happening. Like there could be things that are occurring in front of you, or movies that you're watching, or you're reading a book, or you see an event in real time in front of you. It's like, let's say you see a fight, two people are fighting. There's a good possibility that experiencing and witnessing this event that is occurring in front of you, even if it's like 20 feet or 30 feet away, is going to trigger you to flash back into childhood when you were experiencing a parent beating you and abusing you physically. It suddenly triggers you into that, and you start to think, and you feel like you're back in your childhood years, and you're scared out of your mind, and you're panicking, and your heart starts racing, and you're feeling sweaty, and you're getting overwhelmed, and you might even, and if it's super strong, you could even pass out and cause physical harm to yourself or others around you. You could be driving a vehicle and this occurs, which is very dangerous. And when these things first occur, it's extremely scary and it's horrific because you have no understanding. You don't know why these things are occurring. You can't reason and explain it because it's stuff that is so, like, even though you had it occur to you over and over and over again as a child throughout the years when you were at home, these flashbacks, because you have no connection, right? Like these child parts that are there are not connected to the adult. So in your mind, there's all these separate locations that are in your head that are different parts, and there's no neural connection from each of them and into the adult. So when you get triggered and you're blended with these parts, your mind can literally make you believe that you're back at 6 years old, back at home, and you see your dad coming towards you, and he's got the strap, or he's got a bat, or he's got something, he's gonna hit you again, and all of a sudden you're screaming and you're fearing for your life, when in reality what's happening is you're just in the middle of, you're at work or you're at home with your girlfriend or your boyfriend, and they're going, your partner's kind of sitting there going, what the hell's going on? Why is this person, why is my girlfriend, or why is my boyfriend going crazy and losing his mind and thinking he's 6 years old? Their dad's not here. There's nothing happening. What is going on? And then when you suddenly come out of this trigger and you're sweating and you're breathing heavy and you're freaking out because you just realized that something's wrong, and your partner is sitting there going, what happened? Like, what's going on? And of course you're just starting to recover, so there's a good chance that you have no plan and you don't want to talk about it. All you want to do is go into the room where you want to run and hide and cry and try to recover and make sense of what happened. Like, I can totally understand that, because when you're first experiencing these triggers and you're flashing back, or your parts are flashing back to a day in your life when you were experiencing this horrific trauma, like I said, your mind can't connect to those parts. So you got that child part that was there when it took over, when the abuse started. Your adult has no memories of that. It's the child part's memories that are coming up and are getting into the adult's memories, and that blending is occurring. So of course the adult's sitting there and going, what just happened? And I'm being very mellow, like very unemotional and not very dramatic when it comes to it, because obviously if you have experienced this in the past many times and you haven't done anything about it, like you haven't gone to a therapist, you haven't talked to anybody about this, you haven't started any kind of healing process, and you have no tools to help, you're likely going to be extremely frantic, and you're going to be very emotional and very excited and very scared, and it's going to be so much that you're not going to know what to do about it, and you're gonna want to hide, and you're gonna become overwhelmed with emotions. And I know this kind of thing happens because you don't know how to deal with it. Your body in that present state is just not capable of handling any of the trauma and the stress and the anxiety that comes from it. It's just, it can't be handled. So you need, if this is what you're experiencing on a regular basis, and there are things out in the real world that have nothing related at all to your trauma, and these are triggering your parts into becoming alive and active, you really do need to go and find a suitable therapist. You need to do your due diligence, and you need to find one that is helpful and who knows complex trauma. You have to do your homework. You got to do your research. You got to find someone who specialty is complex trauma, complex post-traumatic stress disorder. You've got to find someone who handles that. You can't just go to any therapist and say, and talk about it. If that isn't their specialty, if that's not what they're specializing in, you're not really going to get the proper help that is required. You're not going to get enough. It's going to be futile. You're just going to get more frustrated. You're going to get more angry. You're going to start to distrust that person because they can't help you. You're going to feel like they don't understand. You're going to feel like they don't get it. And within a few sessions, you're just going to stop going because all you're going to think is, this guy doesn't get it. He doesn't know what I'm dealing with. He has no idea what I'm talking about. He knows nothing. And it could very well cause you to stop trusting them because you're going to think that they're all the same. And that's very common because you already have a hard time trusting people. So if you find the therapist isn't trustworthy and doesn't do anything and only makes things worse for you, you're going to start to think that the therapists are going to be the same way. And it's not going to matter who you go to see. You're going to think the same no matter what. So you need to do a lot of research. You need to really look hard, and you need to make sure that you find someone whose specialty is childhood trauma or complex trauma. There are different ways that it is worded when you go onto their websites and you research the therapists. It's either going to be childhood trauma or complex PTSD. And I know that there are a bunch of different theories out there. Every therapist has their own ways of doing the healing work and going through and helping you. Personally, and I have said this in many episodes in the past, my personal thoughts and beliefs is that if you can find a therapist whose specialty is structural dissociation model or structural dissociation theory, when it comes to 4-step processing and child parts and, gaining your parts trust and building that neurological network in your mind so that everybody can heal and become one again, I would definitely recommend if you can find that kind of therapist, that you go with that one. I'm not saying that the other types of therapy won't work. It's just this one has a lot of promise and a lot of good results, and it is very effective. So I'm not going to tell you who to, go to. I just think that you can get a lot out of seeing the right therapist in structural dissociation theory, and with a lot of people who I have talked to find it very helpful. Okay, I'm just going to take a quick break, and then when I get back, I'm going to read an article about, discovering complex trauma and what you can do. All right, talk to you in a bit. Okay, this article that I've got here is called How Therapy for Childhood Trauma Can Help. By age 16, more than 2/3 of children report experiencing at least one traumatic event, according to the Substance Abuse and Mental Health Services Administration. Fortunately, the right therapy can help children, adolescents, teens, and adults find ways to heal and cope with the effects of traumatic experiences like abuse, community violence, natural disasters, neglect, and sudden loss of a loved one. Here we discuss childhood trauma, the different types, how it may affect you, signs to be aware of, and treatment options for children and adults. What is childhood trauma? A traumatic event poses a threat to a child's life or physical safety. This includes events that are frightening, dangerous, or violent. For some kids, there may be no time for healing between traumatic events. Their life is in an almost constant state of chronic stress and trauma. Examples of childhood trauma include physical abuse, sexual abuse, psychological and emotional abuse, neglect, natural disasters, homelessness, racism, serious accidents or life-threatening illness, violent loss of a loved one, sexual exploitation, refugee and war experiences, community and school violence, witnessing or experiencing family or partner violence, and military stressors like loss, injuries, or parental deployment. How childhood trauma may affect you. Childhood trauma affects each person differently. However, there are some common signs and symptoms to watch out for both in kids and adults. In preschool and elementary age children, separation anxiety, becoming anxious and fearful, difficulty sleeping and increase in nightmares, crying or acting out, decrease in appetite, moodiness, and increased aggression and anger. Teens can experience all the signs mentioned above, plus the following: irritability, withdrawal from social activities, academic problems, self-blame for the event, guilt and shame, feeling depressed, difficulty concentrating, eating disorders and other self-harm behaviors, and increase in behaviors like sexual activity and alcohol or drug use. In adults, unresolved childhood trauma can take on many forms. For example, female adults who experience sexual abuse as a child or teen often show signs of post-traumatic stress disorder, distorted self-perception, shame, fear, guilt, self-blame, humiliation, and chronic physical pain, according to the American College of Obstetricians and Gynecologists. Adults dealing with PTSD from childhood trauma can struggle in their jobs, interpersonal relationships, and with their own mental health. Here are some emotional, physical, and behavioral signs to be aware of. Anxiety, depression, panic attacks, poor concentration, fatigue, impulsiveness, problems with sleep, chronic health conditions, compulsion, self-harm, chronic stress and inflammation, isolation, eating disorders, and suicidal ideation. What treatment is available to help recover from childhood trauma? Childhood trauma can cause adverse effects both immediately and in the future. But the good news is that treatment can help you identify triggers, develop coping strategies, and decrease the symptoms, all in a safe and supportive environment. Here are some of the common treatment modalities for adolescents, teens, and adults. Cognitive processing therapy, CPT. Cognitive processing therapy is a subtype of cognitive behavioral therapy. CPT is often a first choice when treating PTSD, especially when addressing the long-term effects of childhood trauma in adults. For PTSD, the American Psychiatric Association recommends treatments over 12 sessions. This typically involves education regarding PTSD thoughts and emotions, followed by formal processing of the trauma and skill development to identify and address unhelpful thinking related to traumatic events. Trauma-focused cognitive behavioral therapy. Similar to CPT, trauma-focused cognitive behavioral therapy is a subtype of cognitive behavioral therapy. This evidence-based model incorporates trauma-sensitive interventions with cognitive behavioral techniques, humanistic principles, and family support that relies on the participation of trusted parents and caregivers in the treatment process. TFCBT is effective for children, teens, and adolescents who have significant emotional difficulties from a traumatic event, and the duration is typical to 12 to 15 sessions. EMDR, which is eye movement desensitization and reprocessing. Eye movement desensitization and reprocessing is another therapy for treating trauma and PTSD. EMDR uses repetitive eye movements to repattern memories from a trauma. There are 8 phases of EMDR, including history, preparation, assessment, treatment, and evaluation. Research shows that EMDR is an empirically validated treatment to address unprocessed memories related to adverse life experiences and trauma. Narrative exposure therapy, or NET. Narrative exposure therapy is an alternative to TFCBT for people, including children, with PTSD. NET is a short-term individual intervention that focuses on embedding trauma exposure into an autobiographical context known as a timeline. This timeline remains with the patient as therapy is over. NET is most effective in treating people with multiple traumatic events. They really should be talking about CPTSD as well, but it is helpful for both. Prolonged exposure therapy. Prolonged exposure therapy is a subtype of cognitive behavioral therapy used to treat PTSD and other mental health conditions like CPTSD. PE often takes place over 3 months. During the sessions, the therapist helps individuals confront trauma-related memories, fears, feelings, and situations. The therapeutic relationship needs to be stable before exposure begins in the office and outside of therapy. Treatment for children will look different than treatment for adolescents, teens, and adults. Because of this, kids need specialized therapy designed to accommodate their developmental levels and ability to participate in the process. Play therapy. Play therapy uses the therapeutic power of play to help children work through trauma. The target group for play therapy is children ages 3 to 12. During a play therapy session, the therapist can observe a child through play. They can also use this age-appropriate behavior to address trauma and develop coping strategies. Art therapy. Art therapy uses creative expression to address and heal the effects of traumatic events. Art mediums include drawing, coloring, painting, collage, and sculpture. The American Art Therapy Association says art therapy provides an outlet without words. It can help improve cognition, foster self-esteem and self-awareness, reduce conflicts and stress, and cultivate emotional resilience. What other mental health conditions may be related to childhood trauma? Childhood trauma can have consequences well into adulthood. One 2019 study found that adults in psychiatric outpatient programs experienced a higher rate of traumatic events as kids compared to adults not in treatment. Another 2019 study looked at data from 1,420 participants that found that those with childhood trauma experienced adverse outcomes in adulthood, including mental illness, addiction, and health problems. The participants were interviewed annually as children and then 4 more times during adulthood at ages 19, 21, 25, and 30 over 22 years. Of the 1,420 participants, 30.9% said they experienced one traumatic childhood event, and 22.5% experienced 2 traumatic events, and 14.8% experienced 3 or more. The effects of trauma at a young age can result in mental health conditions including CPTSD and PTSD, anxiety disorders, major depressive disorder, eating disorders, and substance and alcohol use disorders. Experiencing sexual abuse as a child can also increase suicide ideation in adults, according to results from a 2017 survey. Can you prevent or lessen the effects of childhood trauma? Preventing or lessening the consequences of childhood trauma is possible. If your child is dealing with the effects of trauma, the first step is showing support. You'll want to find a mental health professional qualified to treat the trauma your child is dealing with and get them into therapy as soon as possible. Family therapy is also recommended. Trauma-focused cognitive behavioral therapy is one form that includes the family in the process. These sessions can help parents or caregivers learn how to support and encourage their children at home. It also teaches parents how to avoid blame, learn how to listen, and watch for worsening symptoms. What's the outlook for people who've experienced childhood trauma? Long-term effects of childhood trauma can increase the risk of mental health conditions like PTSD, CPTSD, and depression, chronic illness, or substance abuse disorders. However, with the right therapy, the outlook for people who've experienced childhood trauma is positive. Depending on the type of trauma and how long it occurred, treatment may take a while, especially if you're addressing these issues as an adult. The bottom line: therapy for childhood trauma can help lessen the impact of abuse, neglect, witnessing violence, natural disasters, and serious accidents or life-threatening illnesses. Addressing these issues during childhood or adolescence can reduce the risk of developing mental health issues like anxiety and depression or chronic conditions. However, seeking treatment as an adult is also beneficial, helping you identify trauma and deal with its effects. So yeah, definitely something that you get an idea as to what it's like and the different things that can occur, the different mental illnesses that come up, the conditions, treatments. You get a good definition by that. So yeah, if you're someone who's dealing with trauma and you're not sure what is going on, and you are really concerned and you feel like you're not getting any help and you're not making any progress and things are getting worse, and you have a history of dealing with childhood related trauma and abuse, whether it's from family or a child caretaker or a guardian, then yeah, like I said, you should definitely look into getting support and help from a therapist and start healing, and look into the different types of therapy that's out there, and find, like I said earlier, find a therapist whose expertise is in CPTSD. That way you get the best care and support possible and faster results to getting support, to get healing and recovering from your CPTSD. It's a long process, but it is worth the effort and the time that you put in. And I hope that you take the time to do some research and look into finding a good quality therapist that can help you and get you in the right path to healing and recovering from your CPTSD. If you have any questions or concerns, or if you want to ask me something, anything basically, you can message me. That is the end of the show. So if you want to contact me, you can email me at livingwithadhdandcptsd@gmail.com. You can message me on Twitter. The handle is at ADHD and CPTSD. You can, if you really think that this is very helpful and my other podcasts are very beneficial to you and you really enjoy listening to them, then I recommend you could either become a subscriber to my podcast on Apple, and you could also go to ko-fi.com, that's ko-fi.com/livingwithadhdandcptsd and CPTSD, and you can donate or tip for me and help me continuing to be able to make my shows. All right, that's it. Hopefully this was beneficial to you and informative. Let me know if you have anything to add. If you want to be a guest on the show as well, you can also contact me and we can arrange that. All right, everyone. Have a great day, and I will talk to you later. Bye.